Hi, this is your 21st Century Pharmacist again. My name's Delenn, and this video, which requires a lot of products to be listed here, and things you're not going to be able to spell too well if they're not written down. So I made this great big board full of stuff that's so big that my face won't fit in here. So, so I'm going to read over this and explain this stuff to you. And it's going to be kind of weird, but I'll do. I don't think I'll ever have to write one so long that it crowds me out. But let's get started. This is for long COVID, and it'll even tell you how to not get severe COVID or long COVID. Number one thing on the list here can prevent both. So let's get started. Excuse me, COVID cough there. Okay, well, here's my pointer. Fasting, right here, the best thing in the world for COVID because it destroys COVID and it prevents it from ever getting severe. People that have high P5-3 levels, I know the P5 is right, I'm not sure about the 3, but people with high levels don't get long COVID, and they don't get severe COVID. And frankly, there's the same thing. If you got severe COVID, you're probably going to have long COVID. So it lasts 6 months to a year. Longer, there's still effects from it. So it's a good thing not to get. Fasting for 24 hours will raise your P5-3 levels. At about 18 hours, all the good stuff starts happening with fasting. Now, the reason it works for post-active COVID, after the active COVID, is because there is your P5-3 levels, true, but after 18 hours of fasting, your body sends out little bitty cells all over the place, all over your body, and they go out and they digest dead cells, enzymes, proteins, whatever in your body, and they provide those raw materials to your body to make new cells from. And number two, the stem cells in your brain develop into new brain cells. So any kind of mental problem or brain injury, you may be able to have some benefit from fasting, like once every week or week and a half. Don't make it the same day all the time, or your body will anticipate it, and the whole thing will not work. And number three, not only does it round up, dead you cells, and also, Y-O-U, your cells, it also goes out and destroys the foreign cells in your body. So it goes out and gathers up and eats all those little particles of COVID in there. And it also eats the whole viruses that are left in there. And believe me, you still have the virus in your body long after you have COVID. And that's why people have relapses and stuff. By the way, all these things are from, the leading medical experts in this field. And they have COVID clinics now. And these are the things they use. I had long COVID. I got rid of it in like 3 weeks. My doctor said it should have taken, with the horrible shape I was in, I had it really bad. Well, I couldn't even talk. Somebody asked me a question, I could have answered it in one sentence, and I was trying to get it out, but I couldn't get it out. That's pretty bad. I'm like freaking delirious. Anyway, I got over it in like 3 to 4 weeks. If I'd have taken everything at once, I would have been rid of it in 3 weeks. And my doctor told me that should have taken me six months to 12 months based on the condition I was in. I was bad. I was white as a sheet. I was like a walking ghost. I couldn't think. Got in a car crash because I couldn't think. Man, I had it bad. But I got rid of it like fast. Man, I got off the oxygen right away. So the first thing after fasting is luteolin. And that helps with your brain fog and inflammation, because the brain fog comes from the inflammation. Also, the inflammation, it causes all kinds of inflammation in your blood vessels. Luteolin tablets, luteolin, I think there's only one strength out there. I believe you take one a day. I forgot to write that on there. So that'd be one a day. But also the inflammation is responsible for congestion in your lungs and inflammation in all your blood vessels throughout your body. So it makes you feel terrible. So also, along with the luteolin, you take statins, which your doctor has to prescribe, like cholesterol medication. Well, the doctors think that they work by lowering cholesterol. Like I've said before, the doctors have no clue unless they're, like doctors of nutrition, or maybe they're teaching the new doctors that. But I've known long since that statins work by reducing inflammation in your blood vessels. So you got all these mast cells in your body, and something hits them and triggers them. They're like antibodies, kind of, you might think of it that way. They're white blood cells. They go around, something hits them, boom, they explode. They throw inflammatory systems all over the place, and COVID triggers those things big time. So you've got inflammation everywhere. So you also want to take an anti-inflammatory. Now, I will tell you, you can take Motrin or ibuprofen or naproxen. Tylenol doesn't help with inflammation. But those things have serious side effects. If you take them all the time, like you're an athlete or something, that's my personal theory is that's probably why they all have heart attacks. NSAIDs, non-steroidal anti-inflammatories like ibuprofen and naproxen, can cause heart attacks. They just do. So what you should take is curcumin. Get a brand that says it's enhanced absorption, because absorption is an issue with that product. But in head-to-head studies, it's actually been shown to be better than NSAIDs, like ibuprofen and naproxen, and also prevents Alzheimer's. Let's see. So you just take that as directed on the label. It's usually 2. That's curcumin. curcumin. Okay, then you got cromolyn oral solution. Sorry, little COVID left over there. Cromolyn is a mast cell inhibitor. Remember those little cells I told you about that blow up and cause inflammation everywhere? Well, those are mast cells. So this prohibits that inflammation. Hard to find. If you can't find it at your regular pharmacy, or they can't order it, then ask them if they know a pharmacy in town that orders from a different wholesaler, because there's usually a choice of at least 2 wholesalers, even in middle-sized towns, so or even in small towns. So also let's see, the cromolyn oral solution is 200 milligrams. That's 2 little ampules. Comes in a great big box, about yay wide. Let's see if I can get my hands in here. No, I can't. But about, maybe this wide and this tall. That's a big box. And it's 200 milligrams 4 times a day. That's 2 of the ampules. 2 of those big boxes is a month's supply. Okay. Statins, we covered that. Your doctor has to choose which one and what dose. Beta blockers now, and Clomid, or clomipramine. Clomid, that's probably clomiphene. I forget the brand name now. So, it is clomipramine. Is it? Oh, God. You know, I'm having a total brain cramp. I will fix that by the time we get through here. All right, so I'll come back to that. But these two are for the autonomic storm. Your autonomic nervous system controls everything that's involuntary in your body. So half of that, well, more than half of it, most of it is like adrenaline. But the thing that runs your guts and a few other things is acetylcholine. I said adrenaline, right? Yeah. Okay, that's how you would know it as adrenaline. So you take both of these for the autonomic storm you get, like diarrhea multiple times a day. That's from the non-adrenaline stuff. Adrenaline sends your heart rate and your blood pressure through the moon. They never treated that. I went in the hospital. They never treated that. My heart rate was 130 all the time. And your oxygen sats, they'll control that with oxygen. By oxygen sats, I mean your how saturated your blood is with oxygen. It should be up close to 100%. If you got COVID, it's going to be like 70 or 80%, and you're going to be in trouble. So you need oxygen, and your doctor will put you on that when you go to him and tell him you've got COVID. Okay, now, and also, you know, I remember I told you that those mast cells explode. Well, one of the inflammatory things they release is histamine. So you take famotidine, 40 milligrams per day. That's the max dose of famotidine, and that 40 milligram dose lasts for 24 hours. Also, you take an antihistamine, like Benadryl, or let's see, total brain failure here again. Thank you, COVID. Anyway, any antihistamine, whichever you've used in the past for allergies. Let's see, Claritin or Loratadine. There's a whole host of them. Just follow label directions. And avoid high histamine foods. And find a list on the internet and avoid the high histamine ones and take the ones that say they lower your histamine levels, because there's several foods that do. And the moderate histamine, you know, don't worry about it that much. But if you do these three together, it will do wondrous things for how you feel. Because you're swelled up like a balloon inside everywhere, including your brain. Your brain is all inflamed. And it helps with that. Okay, ascorbic acid for your immune system, 500 to 1200 milligrams daily. Vitamin C, ascorbic acid isn't vitamin C. They call it vitamin C. It's only a small part of the vitamin C complex. Now, they say it works. I don't know. I got to find a good biochemist and find out if ascorbic acid really does anything. But, you know, for vitamin C, eat oranges, apples, potatoes. You can look up good sources of vitamin C on the internet. Okay, anhydrous quercetin, 120 to 500 milligrams daily. This is good stuff. Even works for cancer, for prostate, and bowel cancer. Does wonders. Good stuff. Okay, vitamin D, 1,000 to 3,000. I take 5,000 units every day. I know a doctor that recommends 10,000 every day, at least. But it's not really determined. But it's determined you should have this much if you want to get rid of your COVID, long COVID. Okay, methyl B12. Make sure it's not just B12 and not just folic acid. It needs to be methyl B12 and methyl folic acid. 5 milligrams of the methyl B12 and 1 milligram of the methylfolate, which would be 5,000 micrograms or 1,000 micrograms. You take each of those daily. Now, if you don't take these forms, COVID blocks the transformation of folic acid to methylfolate, which your body uses, and the metabolism of B12 to methyl B12. So if you got COVID, this ain't happening right here. Your B12, your B vitamin conversions. And these are extremely important. Without them, you're going to feel like you had COVID or something. Okay, and take magnesium. Over-the-counter magnesium, 1 tablet a day. Let's see. Now, what I didn't say is CoQ10 I could put right here. If you're taking statins, oh, I left some. Oh no, I got it here. I didn't. I passed it over. Okay, I'll talk about it. If you're taking statins right here, you'll be taking something to give you energy. Well, the statin is going to soak up all your energy, so you have to take CO, letter Q10, coenzyme Q10. Yeah, I guess I won't elaborate on that. One form's better than another, but that's either way, it should be okay though. And you need to take nicotinic acid. You can buy that over the counter, but it's got to be the immediate release. If it says it's sustained release, don't take it. That will help to cure maybe 40-50% of the people that have long COVID. But nicotinic acid can give nearly 100% cure rate. Much more effective. It's the immediate release. Take 100 milligrams at the most. 100 milligrams is a good strength. Here I've scratched it off. But if you take the 250s, you're going to be, you won't be a redneck. You'll be a red everything. Your face, your body will turn just bright red because all your blood vessels dilate. All the blood goes to the surface of your skin, and you itch like a madman. It's horrible, and you're hot, and you're flushed. So take 100 milligram, the low strength immediate release, and you take it 3 times a day, and that gives you energy. And you know what? I took my first one when it came in the mail from Amazon. Well, it came from the UPS guy, from Amazon, late at night, and the next day, I wasn't tired anymore, and I haven't been exhausted since. I used to have to pull myself up the stairs, hand over hand on the banister, and climb along as best I could, and I'd be panting and wheezing because of my lungs, and everything else, and my heart rate was going 100 miles an hour, and I was weak. But that all stopped after my very first dose of nicotinic acid. If you don't do anything else, do yourself a favor and take the nicotinic acid. It's over the counter, it's cheap, and it'll give you some energy. COVID shuts down every metabolic energy path in your body except the worst one. It shuts everything off. So there's an alternate path, though. NAD provides a lot of that energy. And NAD, there's an alternate pathway. COVID blocks all of your NAD pathways except this one. And this one, nicotinic acid, uses that one extra NAD pathway that can produce energy for you. So fasting also does the same thing. It uses that alternate pathway, and it provides you more energy too. So don't forget those things. So there it goes. Eek. So anyway, now that's going to take care of all of your chemical needs for COVID. Now I'm going to show you what's next is breathing exercises. This helped me immensely. And like I say, my doctor's astonished at my progress. And this is a big part of it because I couldn't inhale more than a pint, at the very most a quart of air. I tried to use my inhalers and I'd go and start coughing my head off right away. And couldn't use the inhalers. So I found this exercise on the internet. I found other exercises, but this one really strains you. And, no pain, no gain, like they say. That's a bodybuilder's phrase, but hey, we can plug it in a lot of places. And this is one of them. And I'll show you. It's a single exercise. You can do like 2 to 3 sets, whatever you can handle at a time. I could only get 2 because it's killer. Man, it puts the hurt on you, but it puts the cure in you too. So this is it. This is the one. I found this from a respiratory therapist online. I had to go into the hospital with COVID to get the heparin drip. They give you a big bag of heparin, as big as much of your chest, And it took 24 hours to drip that thing. It was such a massive bag. And that helped a lot. But then when I got out, I still had, it was just as symptomatic, but at least I wasn't getting worse anymore. So it put me on the right track. At least doctors in Idaho know how to treat your COVID rather than politicize it. So I'm very thankful I live in a conservative state where the doctors follow the data, not the politics. So they got me doing pretty good, but I still couldn't breathe much. I was on oxygen. So I learned this breathing exercise. It won't take me too long to tell you about it. So I'll turn sideways. All right, so first thing you do is 4 times you use your diaphragm to breathe. So your belly will distend. You want to suck everything down into your belly. You do it 4 times, and then you cough at least twice. But you'll probably be coughing a lot more. So here you go, diaphragm. Hold it for a while. Used to be I could only hold it for a second or 2, but I got better and better. So here's another rep here. Oh, wait a minute. I did that more with my chest. Hold it as long as you can, and let it out. I'm not holding it as long as I can because I can do great now. I got about 80-90% of my function left. So you do 4 reps of that, and then you go. By the time you get done doing this 2 or 3 times, you're hacking like crazy, but it gets the stuff up out, gets the mucus up out of your lower lungs into your upper lungs, and you can cough some of it up. But even if you don't, it gets it up out of your lower lungs. And that's if you've got COVID pneumonia, which you probably have. If you have bad COVID or long COVID, one follows the other, then you're really in trouble in your lower lungs here. And you can get permanent loss of function. So then after you do 4 of those, then you do 2 sets of 4 with your upper chest. So you go. There's one. 1 rep. 2 reps, and then you do a total of 4 reps and cough twice. 4 reps is 1 set. Now, I can tell you that it'll be a challenge to inhale. You'll learn you can't inhale all the way and hold it, perhaps, but do the best you can. But when you hold it, at first you're going, your lungs want to do something. You just feel your lungs pressing. So you just relax, and then that feeling will go away shortly, and you can hold your breath longer. But while you're doing this, your shoulders should be relaxed. You should be upright, so your airway is good and open. Okay, so you do 1 set of 4 of the belly breathing and 2 sets of 4 of the chest breathing. And you repeat that at least once and hopefully a 3rd time. And do that 2 to 3 times a day. And you'll make remarkable progress. You'll really, really make progress. And after I'd been doing it, and I hadn't been doing it that long, I asked the doctor, so how do my lungs sound? And he said, cough for me as hard as, or breathe out as fast as you can. And so I did. And he said, well, you've got good air movement. You're doing well. And I guarantee you that I wouldn't have been doing nearly as well without those breathing exercises. And they will get you off that oxygen if you got long COVID. Like I say, I had full recovery. It could have been 3 weeks if I'd known everything. But I found this info out from the internet as I went. I started out with all the stuff here except the beta blocker and the clomiphene, is it? Anyway, clomiphene, is that the one pregnant women, that women take the one to get pregnant? Oh, I can't remember now. But it's the one they use for, among other things, they use it for a lot of things. But since I can't remember the name, then you can tell your doctor that it's the one they use to curb your swearing if you have Tourette's syndrome. And it's 1 milligram twice a day. Anyway, those 2 I didn't learn about until I got tired of my heart rate being 120. So I went on the internet and I found that, and I called my doctor the next day. I went and I got those 2 medications, and my heart rate came way down. It's usually 70 or 80 now. It's ordinarily, before I got COVID, it was in the 70s because I lost a good amount of weight. And you see here isn't, if I stand up straight, it's not that much. I got 20 pounds to go to be slender. But anyway, that is, it should be everything to get you out of COVID. So good luck to you, because it's a horrible thing. I hope you watched this whole video, because if you did, then you'll get rid of your long COVID quick. All right, so anyway, hope this helps somebody, because it's from the greatest, the experts in their field. So it's real stuff. It's real. It worked. I'm doing great now, and I'm glad of it. So anyway, see you next time. Goodbye.